Hello everyone, my name is Luis Marin, and for my educational infomercial assignment, I will be presenting on the subject of sexual pain disorder. This presentation will focus on the following two types of sexual pain disorders. Vaginismus, the persistent and or recurrent involuntary spasm of the muscles of the outer third of the vagina that interferes with sexual intercourse and causes marked distress or interpersonal difficulties. Dyspareunia, persistent or recurring genital pain ranging from mild to severe that is associated with intercourse and that causes marked distress, interpersonal difficulty. By definition, the pain must be persistent and recurring. Other types that will not be covered are listed here at the bottom. General overview of vaginismus. Muscles around the vaginal opening go into involuntary spasmodic contractions, preventing insertion of the penis, of the glands, finger, tampon, or speculum. Occurs in some women during sexual activity or during pelvic examination. In rare cases, the vaginal entrance becomes so tight that the penis or other object cannot penetrate. This may occur in conjunction with other sexual function difficulties such as hyposexual disorder or dyspareunia. Symptoms of vaginismus. Common symptoms include difficult or impossible penetration, entry pain, uncomfortable insertion of the penis, ongoing sexual pain of unknown origin with no apparent cause. Women have described the pain as tearing sensation or a feel like man is hitting a wall. The picture to the top right illustrates the difference between normal expansion of the vagina. The picture on the bottom right illustrates the difficulties of sexual penetration that are associated with vaginismus. The symptoms of vaginismus can vary significantly in their severity. Minor discomfort, burning and tightness, involuntary tightness, significant pain. These are the 4 levels of severity that occur with this type. Causes of vaginismus. No known exact cause of vaginismus in the medical community exists. Some of the non-physical causes that are believed to exist are fear or anticipation of sex, general anxiety, issues with a sexual partner, or past sexual traumatic events. Some physical causes include medical conditions such as a urinary tract or yeast infections, childbirth, menopause and hormonal changes, pelvic trauma, or physical abuse. Treatment for vaginismus. Vaginismus is considered one of the most successfully treatable female sexual disorders. Treatment does not typically require drugs, surgery, hypnosis, nor any other complex invasive technique. Recognized effective treatments include Kegel exercises, insertion and dilation training, pain elimination techniques, and professional therapy. A general overview of dyspareunia. Dyspareunia is a medical term that simply means painful intercourse. It is a general term used to describe all types of sexual pain. This disorder can occur in both men and women. Pain that occurs exclusively as a result of a medical or psychological condition such as an STI, acute infections in the pelvic area, or menopause are not dyspareunia. Diagnosis of dyspareunia usually has a strong psychological component. Vaginismus is closely related to forms of dyspareunia in that any type of general sex pain may trigger vaginismus. Symptoms of dyspareunia. Pain only at sexual penetration or entry. Pain with every penetration even while putting on a tampon. New pain after previously pain-free intercourse. Deep pain during thrusting. Burning pain or aching. Throbbing pain lasting for hours after intercourse. The picture to the right illustrates the painful deep penetration associated with dyspareunia. Causes of dyspareunia. Entry pain is pain during penetration that may be associated with a range of factors: insufficient lubrication, injury, trauma or irritation, inflammation, infection or skin disorder, vaginismus, or congenital abnormality. Deep pain usually occurs with deep penetration. Certain illnesses and conditions can bring this about, as well as surgeries or medical treatments. Emotional factors are deeply intertwined with sexual activity and may play a role in any type of sexual pain. These include sexual problems, stress, or a history of sexual abuse. Treatment for dyspareunia. Options vary depending on the underlying causes, but medication and therapy are typically described. Medication could be used for an infection or a topical estrogen for menopause. Osphenia is a drug used on women with vaginal lubrication problems. Therapies include desensitization therapy, Kegel exercises, counseling or sex therapy, or cognitive behavioral therapy. Thank you for your time, and I hope you found this video to be both helpful and informative.